This is Ruth. Ruth has a really bad tummy ache and her GP thinks she should see a specialist. Ruth really doesn't want to go to hospital. Ruth's GP sends her to the local hospital for an assessment. Day 1. Ruth isn't allowed to eat or drink. She looks around at all the sick people and feels like a bit of a fraud on the ward. She'd rather be at home and look after her children. She's examined twice and told she needs a scan. That evening, she's allowed something to eat. She misses her children. She doesn't sleep much that night. Day 2. Ruth's pain is worse, but there are more urgent patients. So she has to wait until the afternoon for her scan. Again, she's not allowed anything to eat or drink. That evening, she discovers her ultrasound is normal, but she might have appendicitis. She'll need surgery, but she has to wait until the next day. She has another bad night's sleep. Day 3. The operation goes well. Ruth feels much better and her pain is gone. She's told she has to wait until the next morning for the doctor to discharge her and prescribe take-home medicines. Day 4. It takes until early afternoon to get her medicines. And finally, she can go home. Ruth is relieved and still pleased with her treatment. But was there another way? Ruth really doesn't want to go to hospital, and her GP feels she can be seen by the Surgical Ambulatory Emergency Care. Day 1. Ruth goes home, organises her childcare and phones work. She stays the night at home. Day 2. Ruth isn't allowed anything to eat or drink. She sees the consultant and goes straight for an ultrasound. An hour later, she's told she may have appendicitis. It'll require surgery. The surgery is done that afternoon. By the evening, Ruth is feeling much better. All her tablets are ready, so she goes home. Which option would you prefer?